Sure.
So Dr. Nadal, what do you think, you're from New York State, you're a microbiologist. What do you think of the prospect of Governor Cuomo's Reproductive Health Act essentially making abortion and contraception fundamental rights?
Well, I think that has a lot of, the implications for abortion and contraception becoming fundamental rights naturally is going to extend itself to teenagers and to children even in their preteen years. In New York City, they hand out Plan B, emergency contraceptive, which is high-dose hormone, to children without any parental notification. This has drastic consequences. In 2009, Dr. Jessica Dahl from the Fred Hutchinson Cancer Research Institute in Seattle, Washington, world-renowned, they're kind of like the Sloan Kettering of the West Coast, if you will. In conjunction, though, a co-author, Dr. Louise Brinton, who's the branch chief in epidemiology for the National Cancer Institutes, put out a major epidemiological paper taking a look at the risk factors for the deadliest form of breast cancer called triple-negative breast cancer. It's the most aggressive cancer, most difficult to treat, highly lethal to women. And what they showed in this paper was that women who take oral contraceptives after the age of 22 increase their risk for triple-negative breast cancer before the age of 40 by 240%. For women between the ages of 18 and 22, the risk goes up 270%. And for women who start this before the age of 18, so now we're talking children, right? By definition, they're not women, they're children. Children under the age of 18, and when they start this, the risk goes up 540% for the deadliest form of breast cancer before the age of 40, premenopausal triple-negative breast cancer. What's even worse, consequence for New York State, is that we know that African American women have much greater incidence of breast cancer. This study was done out on the West Coast in Washington State, and there's a note in the study that says there were not enough black women in the study to extrapolate the data to the black community. So these are the data for white women who have the lower incidence of breast cancer comparatively. Now, we know in New York City, in our inner city schools, that there's a disproportionately higher number of black children. What are the consequences for this? God only knows. We can extrapolate from the data on the white community. Those numbers aren't too promising.
No.
And in that paper, even though there's a big denial that there's a link between abortion and breast cancer, Dahl and Brinton listed oral contraceptives and abortion in the results section as known or suspected risk factors for breast cancer.
Amazing. Amazing. So are there any other factors or any other thoughts that you might have on the concept of making medical treatments like contraception fundamental human rights?
Well, I think, I always like to go with the mainstream data, okay? So I think a paper by Jessica Dahl and Louise Brinton, that's about as mainstream as you get. They're highly renowned, very well-respected researchers. These are their data, these are their conclusions. If we look to the Centers for Disease Control and Prevention, if you go on the web and Google fact sheet for the male latex condom by the CDC, there's an opening paragraph, and it talks about consistent and correct use of the male latex condom, which presumably will be handed out to children in school under this bill. And the male latex condom, in this fact sheet, they talk about consistent and correct use. When we talk about using a condom consistently and correctly, by correctly we mean you have to use it exactly right. Consistency means every time. So that translates into perfect use, okay? Even with perfect use, they say the surest way to avoid transmission of STDs, including HIV, the virus that causes AIDS, is to 1, abstain from sexual intercourse, or to be in a long-term, mutually monogamous relationship with a partner who's been tested. So basically, the Centers for Disease Control got to the top of the mountain and found organized religion sitting there all along. Because basically what they just did is reformulate 5,000 years worth of organized religion's morality. Virginity followed by fidelity. But the most noteworthy part of this statement, right at the beginning of this fact sheet on the male latex condom, is that they don't mention the male latex condom as one of the surest ways to avoid the transmission of sexually transmitted diseases. As a matter of fact, when it comes to HIV, they say the studies show that they're highly effective at preventing the transmission of HIV. Good, so be it. When you get to chlamydia, gonorrhea, trichomoniasis, it says it reduces the risk. That highly effective is gone. So now we see that it reduces the risk of transmission. When you get to the genital ulcer diseases such as herpes and or human papillomavirus is listed in that category, the fact sheet says that even with consistent and correct use, that these diseases can occur in the areas that are covered or protected by the condom as well as in areas that are not. Wow. So there's a descending hierarchy of efficacies for the male latex condom relative to the transmission of STDs. And this is the CDC's fact sheet for public health personnel, not for the public, for public health personnel. This is their fact sheet. And in their fact sheet, they say the surest way to avoid transmission of STDs is abstinence or long-term mutual monogamy. They don't mention using the condom.
Wow. And so this whole issue with respect to contraception,
excuse me,
contraception and minors, and making contraception a fundamental right would essentially circumvent parental involvement in reproductive health care of their child. How do you?
The Centers for Disease Control every year publishes what they call their sexually transmitted disease surveillance report, and you can go to the web, Google Sexually Transmitted Disease Surveillance Report. 2011 is the most recent year. All right, the report just came out in December of 2012 last year. If you look, there are graphs that break down each STD by age group, 10 to 14, 15 to 19, 20 to 24. And when you look, you'll see that the bulk, the overwhelming majority, about 80%, 85% of STDs occur between the ages of 10 and 29. In young people. Now, it's well known. This is a little well known neurophysiology, and the insurance industry has this. Is that the frontal lobe of the brain is the area where prudential judgments are made. It's the area responsible for prudential judgment. Okay, the insurance industry knows the data that says that the frontal lobe of the brain doesn't fully form until around age 23 to 25. Okay? You start handing contraceptives out to children, 10 years old. You know, International Planned Parenthood Federation, in their booklet, Stand and Deliver, says that they define youth, young person, and adolescent as anybody between the ages of 10 and 24. So they collapse all of those developmental stages, those differences, into just one category, 10 to 24 years old. So when you start handing contraceptives out to people on the lower end of that spectrum, what kind of prudential judgment do they make? What kind of prudential decisions can they make? How responsibly can they handle? Oral contraceptives are now very low dose. If you're off by a couple of hours in what time of day you take your pill, you could lose the contraceptive effect for that month. Well, now that sets the girl up for an abortion. Or if they don't handle the condom properly, they'll elevate their chances of a catastrophic failure even higher than they already are, because again, the CDC said the surest way to avoid transmission of STDs is abstinence or long-term mutual monogamy with a partner who's been tested. No mention of the condom. Okay? As far as parental rights go, there's a real issue of parental rights here. I'm a father of 3 small children. A school nurse couldn't hand one of my children so much as an aspirin without losing her license. All right? But she can hand my daughters oral contraceptives, hormones? Really? We can juice our children up with hormones and the parents don't need to know about this? In a lot of states, the abortion clinic will come with the van and take the child off to have a surgical abortion in the middle of the day. All you got to do is go find some judge who'll give you what's known as a judicial bypass. You find some judge that'll just sign off on this. The parents never need to know. You give the girl a surgical abortion, send her home. The parents still don't know. And what are the odds that if that abortion is botched, that child might hemorrhage in the middle of the night?
Right.
All right? If I take my child in for a tonsillectomy, I have to sign all kinds of waivers and releases. But the school can send my child out for a surgical procedure, juice my child up with hormones, and I as the father, my wife as the mother, have no right to know? Only when it comes to abortion or contraception do all the norms of informed consent go flying out the window. A child is not capable or competent of giving their informed consent. That's why they have parents and legal guardians.
Yep, it goes back to the prudential development of the brain.
It does. But yet, we can have a child walk in and ask for a surgical abortion, ask for hormonal contraception, and there's absolutely no parental input here. The only area of medicine where this happens is with abortion and with contraception. You couldn't do it in any other branch of medicine. You couldn't do it for any other procedure. A child couldn't walk into a dermatologist's office and ask for the mildest skin procedure. They'd have to go get their parents' consent. But we can do surgery and juice children up with hormones, and that's just A-okay. This legislation is wrong. This legislation is immoral. And the governor should be pushing for the highest possible standard of care for women. The governor should not be lowering the standards. He should not be lowering the standard relative to who can perform abortions. Why isn't Governor Cuomo out there saying it should only be a board-certified OBGYN in good standing? A lot of abortionists aren't even OBGYNs by training. They've washed out of other areas of medicine, and they're able to perform abortions. Why isn't the governor fighting to raise the standard for women so that when they go for these inherently dangerous procedures, they have the best possible care? Why isn't the governor, pushing for parental notification, parental involvement in these decisions? A lot of these children who show up pregnant get pregnant at home. They're the victims of child sexual abuse. And the abortion industry and laws like this, all they do is cover for the perpetrator. There's no consequence because there's no investigation. And that's wrong. So all of the standards of decency go flying out the window with legislation like this. And quite frankly, even though I'm ardently pro-life, if somebody says they're pro-abortion or they're pro-choice, I think they ought to be militating for the highest possible standard of care for women and children and not lowering the bar below its already low set point.
Yeah. Let me ask you another question. I want to shift gears here for just a minute, and that is I want to talk about the aspect of the legislation that dehumanizes the preborn child. And this, you touched on this notion of care for women, lowering the standard of care for women versus heightening the standard of care for women, and what does from your perspective, by dehumanizing the child in the womb, it lowers the ramifications for abusers of pregnant women. We know that the CDC basically came out saying that the second leading cause of death for pregnant women is domestic violence. Mm-hmm. And if you dehumanize the child in the womb, then if a child dies because of abuse of the pregnant woman, and she miscarries at 8-9 months, the child dies, he doesn't get manslaughter. He doesn't get charged with homicide.
Right.
What's the impact of this dehumanization for women's care?
Well, if you dehumanize the child, then you can begin to legalize more aggressive procedures for going after that child. And the more aggressive the procedures, the more inherently dangerous it is for a woman. Look, even with the best of medical care, obstetrics, pregnancy still remains, a kind of dangerous endeavor here. Pregnancies are not easy for all women. And when you take a situation where a woman may not be having an easy pregnancy, you lower the standard. You have substandard practitioners in there. You don't have OBGYNs in good standing. The reason why they don't push for that is because OBGYNs in good standing, for the most part, don't want to have anything to do with abortion. They hate it. They find it reprehensible.
Why?
Because they became baby doctors to deliver babies, not murder them. And I think science has proven in the last decades, as we've been able to look inside the womb with 4D ultrasounds, with embryoscopy, there's no shred of doubt that this is a human being in its earliest stages of development, and by 8 weeks, their organ systems are all formed. You look at the anatomy, you see a formed human being there. Okay? So it has horrible implications across the board. If we don't recognize the humanity there, where do we recognize humanity? It becomes fungible. And anybody that would go after that baby using a sonogram to help in the search and destroy method, they know the humanity of that child. How much regard do they have for the humanity of the mother? I wonder. But I know we have people like Kermit Gosnell, who's been brought up on capital murder charges in Pennsylvania for running a late-term abortion clinic where he just butchered babies, and now the allegation is he also butchered the women. So, you know, there's this desensitization to life. It's hard to keep that compartmentalized. You become desensitized in one area, it tends to spread throughout the rest of your life like a metastatic cancer, which is why integrity tends to be an all or nothing phenomenon. But I don't have a lot of integrity in this area, no integrity in that area.
Excellent. Thank you, Dr. Nadal.
You're welcome.
I really appreciate it.